Today's topic is health insurance personalized. Let's go into what exactly is all about fuss about this health insurance personalized, so-called HIP. It is a public-private partnership, folks. It's not completely private. It's a public-private partnership. Its strength is it provides a unique solutions depending upon your health profile, where you get your health insurance either from the employer or a personal purchase. Let me explain how that works. If you're one of the 200 million Americans, you fit into these four categories, folks. Four categories. One is the larger employer-sponsored plans. Number two, smaller employer-sponsored plans. And number three, individual purchased health insurance. And number four, you're one of those uninsured. Let's dig deeper into it, what this is all about. And under the larger and smaller employer plans, it may be self-insured or fully insured plan under both a larger and smaller employer. Either you're self-insured or you're fully insured. If you're uncertain, ask someone in the human resource department, folks. Ask. They'll tell you, it's no secret. Generally, if your company has fewer than 50 employees, it is fully insured. You know why? Because under 50 employees, they're not self-insured. Larger employer, over 50 employees under the larger employer group, they're all self-insured. But under 50 employees, you're fully insured. You're not self-insured. I'm not sure if you get that point. When you say fully insured, you don't have any deductible plan. Whereas self-insured, employer pays the deductible, and the larger employer groups have self-insurance, and they're more flexible than compared to when you're fully insured, you're guided by the insurers or insurance companies. If you have more than, as I said earlier, if you have more than 300 employees, you are self-insured. And most of them have a deductible policy. The employer takes care of the deductible. And that's how the larger employers are able to save big times on the self-insurance. Let me go into detail. How does the self-insurance employer works? These large self-insured employer groups, over 50 to 300 employees, under the self-insurance plans, there are 120 million and its family members. Employer pays the claims and uses an administrator, sometimes it's an insurance company, could be, to manage claims and other services, legal, actuarial, educational, enrollment. All the services are employer puts up the bill. Employer is at risk in the larger self-insurance. Employer is at risk and is responsible for any claims And whereas smaller, under 50 employees, they are fully insured. They are dictated by the insurance companies. These insurers provide employer-subsidized health plan to 45 million employees and family members. When you're saying fully insured, in which employer pays a fixed premium to an insurance carrier for a payment of claims and all services, the insurer is at risk. See, this is where it is. Insurer is at risk and is responsible for paying the claims, whereas larger employers, employer is at risk. When you have smaller employers, insurance companies or insurers are at risk. In a small company, individual voice and concerns are more likely shared. Talk to your benefit manager about options and alternatives. And the third, I was talking about large, small, and individual. Third one is individual policy. If you do need an individual policy, either you're self-employed or your employer does not offer health insurance. About 15 million people have individual policies. 15 million. 11.4 million purchase individual policies through federal insurance exchanges, a government structure set up under Obamacare. 11.4 million. Another 3.6 million purchase insurance directly from the insurance companies. If you really need to, if you are one of those uninsured, this is the fourth category, if you are one of those uninsured, estimated 28 million were uninsured in 2019. Some insured are between jobs, can't afford a COBRA. COBRA is a temporary continuation of coverage. They can't afford the COBRA. So majority of the uninsured are the working poor without access to employer subsidized health insurance. If affordable insurance is available to meet their unique needs, some are uninsured by choice, not because they couldn't afford it, by some to save the money. They didn't want to buy the insurance. Reason they are uninsured, either they are between the jobs or couldn't afford the COBRA coverage, and a temporary 6-month catastrophic plan may meet their needs. For a long-term coverage, you have to have an insurance agent and a price plan that meets your budget for individual policy. There's an old saying, legislation tends to crowd out of the future. Legislation tends to crowd out of the future. It means once the government gets control, it is really hard to change or modernize the programs. This is why it is so difficult for the government programs to be modernized. What are the government programs? I will tell you what they are. Number one is Medicare. For people who are 65 and older, It is running out of money. It's running out of money. Medicare is running out of money. Baby boomers are overwhelming the Medicare system. The coverage is so inadequate. Coverage is so inadequate that many have to purchase expensive Medicare supplemental policies. That's what is happening. What is the second government program? Is called Medicaid. Medicaid, government insurance for the poor, is draining federal and state budgets and is fraught with fraud. Yes, it is fraught with fraud. Payments to care providers is so low that many doctors do not accept Medicaid payments. I am one of them. I received, after seeing about 10-15 patients, I billed the Medicaid. I got a check for 1 cent. They listed all the patients and they gave me a 1 cent check from Medicaid. This Medicaid insurance card limits the healthcare who need the most care. This is the problem. Medicaid card is only in the name only, but it doesn't provide the care what people need the most. Those are the people they need the most care, because they are the one who are the sickest and they don't get the right care because providers refuse to see them. This is the problem with Medicaid. What is the third one? Veterans Health. Veterans Health System has a long wait lines, inadequate care, TRICARE for military health, children's health insurance program, so-called CHIP, etc. These are all government programs. They all need reform and added flexibility to improve coverage and patient care. They all need reforms. They need more flexibilities to improve the coverage. Solutions to the government controlled programs are difficult, folks, because significant lobbying interest and resistance from the special interest constituents. Too often, comprehensive solutions. They talk about comprehensive solution include these are the programs which I mentioned. These are the comprehensive solutions what they were talking about. That is usually kiss of death for any proposal. Reforms typically decried as hurting the poor. Yes, hurting the poor, throwing the grandmother over the cliff. Let's set these issues aside. Let's focus on 200 million Americans getting health insurance through private market. Let's look into that. So these larger employer self-sponsored plans, they need some reforms. What are those reforms needed? Is called definition. We need a definition of full-term employees. We need price transparency, and we need quality measures. They need to be reformed in that aspect. What are the small employer-sponsored plans? They also need reforms. Smaller employer groups need guaranteed issue of pre-existing conditions, folks. Guaranteed issue. Eliminate single risk pool. For the smaller employers, they really need badly. They need to segment the risks between the well category, at-risk category, chronic illness category, and catastrophic. They need to be segmented. So the premiums for a smaller employees, premiums have to be affordable. The only way you can do it is segmenting. And these are all provided by private insurance companies. There's nothing unless you change, unless you reform it. They normally private insurance companies, they don't want to segment the risk because they want to collect higher premiums from all the folks. So they have a broad category of collecting the high premiums, irrespective of the age, irrespective of sex, irrespective of health conditions. They all are broader. So premiums are not really, they are true premiums, but basically people, if the hospitals are providing, uncompensated care, they keep billing these insurance. So obviously the insurance company have to survive. So that's why they don't want to segment. So that's why they raise the premiums for ordinary folks. When it comes to third category, individual policies, yes, we need some reforms. What are those? Guaranteed issue and pre-existing conditions. We need a guaranteed issue for individual policies. Choice. Need choice. Desperately, we need choice. Affordability. And the impaired health support and elimination of single risk pool. For individual policies, people just can't afford the premiums. You need to segment. That's where we need reforms, folks. For individual policies, we need reforms. They need to be segmented. What is the fourth one? When it comes to uninsured, yes, uninsured, that's a problem. And we need to address those problems. We cannot punish the all the Americans just because you have 28 million uninsured. You cannot punish the ordinary folks who are healthy. There has got to be a better solution for the uninsured. Instead of punishing the normal folks and healthy folks, all the Americans, there has to be reforms. In what category? In what aspect? They need guaranteed issue of insurance and also need coverage for the pre-existing conditions. They need choice. For uninsured, yes, they need choice, affordability, and impaired health support. They need, if they're physically impaired, they need support. And health review authority under the public-private partnership can fulfill all these things, folks. That's the beauty about health review under the public-private. They are the enforcers. They will give a guaranteed issue for people who are uninsured, people who have pre-existing condition, people who are economically insured, affordable. If they are denied by an insurance companies, health review authority has the supervision over all the insurance companies under the public-private partnership. I think health review authority is a big aspect of guaranteed coverage to these folks, especially for the uninsured. You may ask, well, how about Medicaid? Medicaid, for the poor. Well, I don't know how much you can reform Medicaid. I would rather see enforcing by the health review authority. People who don't buy insurance, they lose the exemptions. As a result, federal and state governments will be able to collect more revenue for people deliberately not having insurance. As a loss of exemptions, you collect more revenue, and that will be able to support people who are impaired, people who are economically impaired, physically impaired. So we also need, what are the other solutions for to cover the uninsured and impaired group? We need some block grants to states and eliminate waste. There's so much of waste in Medicaid, fraud and abuse, and work requirements, long-term care. This Medicare is filled with bureaucratic nightmare. There's a lot of fraud. So that I'm not sure if there's any solution to. I would rather have a health review authority look into it and address that and give them the certificate of merit. Medicare, well, that's a different issue, folks. Medicare, we need reforms. We need some reforms in Medicare. What is happening, so-called Medicare Advantage, is a Medicare disadvantage because senior folks are losing the control on their health. Basically, Health and Human Services is pumping that individual funds from the senior folks into the private insurance company. I wish they give that money to the senior folks. They can come up with their own health insurance. So they have a choice of buying their own private health insurance. So they can have, not only if they want to get into Medicare Advantage, fine, but let the senior folks decide instead of coming down from the top. And again, Medicare Advantage, there's a lot of overhead and there is a lot of costs, middlemen stifling the funds. There's a fraud and the prescription drug costs. And that's one of the problems I see. Even Medicare needs to be, let the senior folks decide what they want. So rather than government telling them and giving the funds to the private insurance, they should invest in the senior folks. I think they have a solution. If the senior folks gets to have those funds, they're mandated to get their own health insurance at an affordable, and they can also put money aside into health. They should be able to put money aside into health savings, personal care accounts. People are healthy, they can put money aside. That's the way to go, man. That's the way to go. TRICARE, they are flexible, they are private care options, So those are the facts, folks. Those are the facts. So-called personalized health care can be personalized if you believe in folks, if you believe in the consumers. It has to be consumer-driven, patient-centric, consumer-driven, patient-centric. There's no one-size-fits-all approach. Let the consumers decide what insurance premium they want to pay and how much they can put aside into the health savings account. Personalized health insurance is a voluntary, hassle-free idea, folks. Hassle-free idea that focuses on the importance of health insurance affordability. That's what it is. Health insurance affordability and choice. That's a choice. Consumers, patients have choice. It does not manipulate or mandate any plan or design. It doesn't mandate any plan or design. With personalized health insurance, I bet you, for ordinary folks who are healthy, their premiums will go down by 15 to 20%, folks. Maybe more. And who can bring the cost down? It's not the government. It is not middlemen, so-called insurers. Insurers are not interested. Only consumers can drive down the cost because the consumers' demand is based on their needs and they would like to put money aside into their own personal care accounts. So that way you can drive the healthcare costs down. I bet you your premiums will go down, overall costs will go down. There's more competition, there's more it has to be transparent, folks. There has to be competition. You cannot have consolidation of these hospitals, medical groups. You can't drive the competition away. Only consumers have to choose whom they want to see. That drives up the competition, and it has to be affordable, and prices have to be transparent. It doesn't matter which drug, everything has to be transparent. Thank you, folks, for listening. I love you guys. I love you. My main focus through this nonprofit foremost organization. I want to make sure the healthcare is there for the people who need the most, especially under Medicare. We are not getting it. People who are poor, people who are really sick, they're not getting the right care. They're not being focused on, because under the personalized health, the focus is on people who are really sick and have chronic illnesses. Under the personal health insurance, personal health care, focus is mostly on that 2 to 3% of the population where they need the health care the most. That's what our focus should be. People who are physically disabled, physically handicapped, people can't afford the premiums. We have a right to provide them the right healthcare tools they need, folks. Thank you for listening. This is Consumers Doctor on the behalf of Foremost Organization. I love you guys. We will see you in the next episode. Salute.